Hi, hello friends, welcome to World Explorer India. Today let us discuss about palliative care. What is palliative care? Palliative care is being given to the disease conditions which are non-curable and terminal conditions. Usually palliative care is being given to provide care and comfort to the patients who are near to death or who are approaching to death because of the lethal conditions. Hospice care is usually targeted and don't seek curative care. That is given in the terminal stages or 6 months before the death. Hospice care is being given by hospice nurse and family members. Palliative care starts at the time of diagnosis and continues till the terminal care. And terminal care and hospice care is part of palliative care. So what we can say is palliative care is a broad term. So goal of palliative care is to improve the quality of life by including the team. The WHO definition of palliative care is an approach that improves the quality of life of patients and their families facing the problems associated with life limiting illnesses by the prevention and relief of suffering through identification and impeccable assessment and treatment of pain and other problems like physical, psychosocial, and spiritual. So, palliative care is not only focusing on the curative aspect but also focusing on the physical symptoms and psychosocial symptoms and also the spiritual symptoms. So, palliative care is being given for the persons who are facing the life limiting illnesses, and this is to improve the quality of life and to decrease the suffering of the person. So, palliative care plays a vital role in the terminal care and also at the time of diagnosis. Some of the ethical issues and legal issues we have to consider while giving palliative care include confidentiality, that is, we have to maintain strict confidentiality of the patient information, and we should be very well aware of which information we can share with the patient, which information which of patient we can share with the relatives, and which information we can share with the insurers, etc. All these things we have to go according to the hospital policies, and patient has each and every right to refuse your treatment. And if patient is not able to take decision making, there should be a proxy decision making, either it be the close relative or the family member or a friend, whoever the patient has decided, they can act as a proxy. And there are some euthanasia and assisted suicide. This is usually not allowed in many of the countries, but we have to see what are the legal implications. Next, the skills which we need to have while providing palliative care is, you should have a good communication skills, and you should have a good clinical skills and pain management, emotional support skills, cultural competence, teamwork and collaboration skills, and advocacy skills. Why advocacy is, the patient may need some of the financial support, so nurse will act as advocate between the medical social worker and some of the NGOs, and she can help the patient in procuring the financials which is already exhausted by the patient because of the treatment expenses. And also nurse will collaborate with multidisciplinary team for providing the best possible care to the patient, like coordinating with the dietitian to give the diet meal plan, etc., and also with occupational therapist to improve the functioning of the patient. So to improve the communication skills, the nurse should have some of the techniques, and among which how to build a rapport, and if she is having any doubt in the communication, she should be able to clarify and also reflect the emotions back to the patient. Use very simple language instead of using the complex language. Be honest and transparent. Respect cultural and spiritual beliefs. Collaborate with the multidisciplinary teams. Use appropriate body language. Ensure privacy and confidentiality of the patient. Active listening, empathy, clear and concise communication, nonverbal communications, open and honest communication, unconditional positive regard, and open communication. These are all the techniques which we use in palliative care. Apart from this, if there is a poor communication, it will lead to mistrust, anxiety, and decreased satisfaction among the patients. So sometimes patient may get anger. So because of anger, why the patient is developing anger is because they are losing the control of themselves, means they are having anticipatory grieving. That is, if someone is going to tell them that your lifespan is limited because of this life threatening condition, so they may feel that they are losing the control of everything. So they may get some anger, and there is some fear and uncertainty of the medical treatments, and also there are some unresolved issues among the patient from the past. So any of these situations will provoke anger in a patient. So how a nurse should respond in such situation? Nurse should be very calm and empathetic, and always better to use non-verbal techniques in such cases, because if we are trying to tell something, it may again provoke the patient to anger. Allow the patient to ventilate his anger, and involve the patient in the treatment. So goal of palliative care is to provide the best supportive care. So we should be able to identify the physical symptoms like neuropathic pain, numbness, persistent pain, etc. So we should be able to provide good quality pain relief management to the patient. Apart from this, we have to see if there is a colostomy, how the patient can attend a social gathering by using perfumes or by emptying the colostomy bag, etc. All these things we should teach to the patient. Apart from this, patient will also undergo the rehabilitation to improve his strength, and also to improve the activity, and he can provide some occupation so that he can gain his earnings. And we also need to take care of his emotions by observing the patient. If patient is having anxiety, we should decrease the anxiety, and if it is fear, we should ask him to ventilate. If it is social isolation, we should ensure him to mix with others, etc. And one more problem we see in the patients is anorexia. So if patient is having anorexia, we should ask them to have high protein and high energy meals. While doing this, we will coordinate with the dietitian for giving a good menu plan to the patient. And if patient is having vomiting, it is better that we should cut some lemon and give the smell to the patient, so that he will lose the smell of vomiting. And also mouthwashes will help to improve the mouth hygiene, and freshness will be there for the patient. And if there is diarrhea, better to avoid tea, milk and spicy foods, and check any laxatives patient is being used, and try to modify the medication. And total parental nutrition, patient may need if he is undergoing severe malnutrition and the patient is not able to take by himself or herself, then there is the option of total parental nutrition. And some of the patients will be having gastrostomy, and some patients will be fed by nasogastric feeding. And if patient is having diarrhea, withhold the stool softeners and drink clear fluids, fruit juices, tender coconut water. Coconut water is very much essential if patient is having diarrhea, because it will replace the potassium which is lost through the loose motion. And encourage bread diet, that is bananas, rice, apple sauce and toast. Avoid fresh fruits, vegetables and green tea. Avoid milk except curd, and avoid coffee and alcohol. Better to use non-spicy food, and adjust diet if patient is on gastrostomy feeds. So if a patient is having diarrhea, it is better that we should be keep ready ORS, that is oral rehydration solution. If it is not available, we should teach the patient how they can prepare at their home. Like for a 1 liter of boiling water, we should add some pinch of salt and a fist of sugar, and then we will dilute it and then use it as an ORS. So this is the management of diarrhea. Next thing is delirium. Delirium will happen a patient who is long admitted in a ICU, where he is not exposed to sunlight in day and night. So he will be losing orientation to the time, place and person. So it is better for us to ask the patient every time we meet, now it's a morning, it is a good afternoon, or now it is the time for supper or dinner, etc. We should be asking the patient that date, and we should give him a newspaper and make him aware of the time, place and person. And so if possible, move the patient out of the area to sunlight, natural light, so that he can improve his orientation. And also we should give some memory techniques like family photos and some of the clocks and any of the things which he remember. And if we need to tell more, we if patient is not able to remember, we need to repeat the things if necessary. We need to listen to the patient. So this is how we can manage the delirium. And the last topic is the end of life care. So palliative care progress to end of life care in the terminal illnesses, where nurse should be able to assess the physical, psychological, spiritual and emotional needs of the patient and plan procedure accordingly. And for oral care, mucositis will be there, and how we can treat with the help of mouthwash, etc. We have discussed. Bowel care, wound care, care of bedridden patient, lymphedema care.